holding up.
Yeah?
Doing good.
Good. Oh my gosh, it's so good to see you.
Judy, if you've never met her, she would become your friend in 10 minutes. She is unassuming, she is honest, and a great friend of St. Luke's. He was really a good man.
He was a nice
The
man.
first time I met John and Judy Gardetto, it was love and respect at first sight. They always talk of love at first sight, but this year it was love and respect at first sight.
Oh, my husband was here with so many different ailments. John had an aneurysm and he was at St. Luke's for surgery. And he has a very unusual blood disorder. So that's where Dr. Divke became involved. And he helped keep my husband alive for many years, so we were grateful.
I can't tell you how comforting it was to know that we had my father's doctors, Dr. Divke and Dr. Parent, here taking care of my dad. Not only with my dad did we receive this extraordinary treatment, but then again, years later, my husband Dewey was diagnosed with chronic lymphocytic leukemia.
We just spent a lot of hours dealing with the different issues of our spouses here.
I took care of these people for many years, and all of a sudden these gifts would appear, and I would read my hospital newsletter, donated by the Gardetto family. I'm like, whoa, they're really dedicated to this place. This family started a snack sidelight to bakeries on the south side, and it grew into this multi-million-dollar business. I think John would be very proud, and Judy has done all the right things about honoring people.
Early on in my life, I learned that my grandfather had a disorder called Glanzmann thromboblastema. It's a blood disorder that challenged him many times throughout his life. And I always wanted to help find ways to make him feel better. And luckily, my grandparents helped fund a research foundation for this disease. And I was able to get involved with that research, and I really found a passion for helping others and working with patients directly.
They have helped not just research to Aurora, but Dr. Wilcox is going to start the first clinical trial to treat Glanzmann syndrome. And that would not have happened without John and Judy.
Working here at Aurora, I'm really proud to know that through Judy, there's been so many wonderful things that have been able to happen here at Aurora. For example, the cyber knife, just that tool for cancer patients to give them another level of treatment and give them and their families the hope. It's just so wonderful that our family has a hand in it.
I've got numerous family members who've spent their careers working at St. Luke's.
Aurora is in the Gardetto genes, definitely.
Yeah, they're just wonderful people and real givers. Philanthropy here at St. Luke's set up a fund in my name for nursing excellence and recognition. Who do you think was one of the largest donors to that fund? Yeah, Judy. Okay, Judy.
It was just our way of saying thanks.
And I feel so lucky to have a grandmother like you who, I'm able to look up to in my life.
Thank you.
Judy, you and John have been so instrumental in helping people. What for you and John, I don't think Glanzmann syndrome would have had its first clinical trial for therapy. And I'm so proud of passing by the John and Judy Radiation Therapy Center.
The Gardettos are not the only donors to this hospital, but they have been major donors, and I have the privilege of being their friend.
I'd kind of like to stay in the background a little bit. And my husband was the same way, but it's wonderful. I'm honored. It just does my heart good to see people happy and to be able to improve somebody's life and lifestyle. And if that's possible, I mean, I want to be there to do it.